Failure is inability of the heart. Yes, well done. Good morning. Today is 7th January 2024. Today we will know heart failure in renal failure. What is heart failure? Inability of the heart to pump blood to the body adequately we consider as heart failure. This can lead to decreased oxygen supply to the body. The patient will have symptoms of generalized weakness, shortness of breath, PND, orthopnea, and all those things. So we also call them as renocardiac syndrome. It can be acute or chronic renocardiac syndromes. Swimming ಮಾಡ್ತೀಯಾ?
Come, go to swimming pool, madam. Right? Dance, madam. Float, 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 float.
Because you're playing the squash. Hey, well done. Push high. Give me a hand. Give me a hand. You know, Bhavana. Come. Heart failure is very common in CKD patients. There are few important causes for heart failure in CKD patients. First, in CKD patients, as the kidney failure progresses, there will be accumulation of fluid, and the patient will have fluid overload, and this puts a lot of pressure on the heart, and water gets accumulated in the lungs. Second, in the CKD, most of the patients will have associated hypertension. We call as secondary hypertension to CKD. And this hypertension, when it becomes BP, when it becomes too high, sometimes it can also cause heart failure, where the water gets accumulated in the heart. We call them acute pulmonary edema. Third, because CKD patient will have anemia, this will also contribute to heart failure. So the calcium metabolism is altered, and this calcium phosphorus product sometimes gets deposited in the blood vessels, and this causes further damage to the blood vessels, and this also causes stiffness in the blood vessels, leading to high blood pressure and heart failure. High potassium, which happens in CKD as well as acute kidney disease, this high potassium causes heart block, and patient can have high complete heart block and heart failure. Last but not least, most of them neglect is high urea level. That uremic toxins directly damage the heart tissue, and once there is a damage to the heart tissue, slowly they progress into chronic heart failure. How to manage heart failure in CKD patients? We can divide into acute and chronic symptoms. If they come with acute worsening of heart failure, like sudden breathlessness, fluid overload, we usually admit to the ICU or in the wards and start an IV diuretics and restrict the fluid intake. Sometimes the patient might require dialysis also. Whereas chronic heart failure patients, here we start on ACE inhibitors or ARBs, which help in the remodulation of the heart. Sometimes the patient requires beta blockers, which helps in the decreasing the heart rate and decreasing the strain on the heart. Sometimes requires long-standing diuretic.
Like it?
Like it.
What are you eating?
Down syndrome.